I wrote it down. All right. This is part 2 of that chapter 3 forearm and hand. It's a bunch of words that you guys are going to be so sick of hearing. Okay, so let's rock and roll. So we're going to kind of go over some of the muscles that are in the thumb and the hand today. So here is a picture of a bunch of them prone and supine. Wow, brain. Anterior and posterior hand. The way you can tell the difference if you're just looking at this and you're like, I have no clue what I'm looking at. Look for the flexor retinaculum. That is that connective tissue that runs across the wrist. So if you see that, then you are in the right place, and that is the palmar side of your hand. The dorsal side of your hand will have all these fun little tendons that don't have that sheath that runs across it. Also, you can see the fingernails on this one. And there's a cheat sheet here, a little picture. So remember, most of the extensors are all going to be on this side. The flexors, as if we were all flex forward, are all going to be on the soft part of your forearms. All right, let's learn about the thumbs and all the tiny little muscles in between your metacarpals. So the main muscles of the thumbs that we're going to be looking at are the abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis. Remember, if there's a longus, there's usually a brevis somewhere. And then your flexor pollicis longus. So pollix or pollicis, if you see that word and you see this whole long slew of words and you're like, what muscle are they possibly talking about? The pollicis or the pollix is always your great, or your thumb, right? I was going to say great toe. Hallux. But, so pollicis will be a reminder that that is your thumb. If it's an abductor, it's abducting your thumb. It's if there's an extensor, it's on the extensor side of your forearm. And if it's a flexor, it's on the flexor side. Makes sense? All right. Cool. You're like, sure. All right, so most of these muscles are going to be starting at the radius or the ulna somewhere, and then running down. Since it's moving the digits, it's going to be on the joints of your phalanges, so that it does that motion. Makes sense, I hope? So you're not going to need to learn every single attachment point for these muscles. Just kind of know the general direction or area they're in to start. Now, if you start working on people and you're specializing in hands and stuff, maybe that's going to be your specialty, which that's great because nobody does that. Then you're going to need to know more extensive attachment points. But for the time being, just learn where they're at in the body. So the abductor pollicis, yes, it does its abduction of your thumb, which is bringing it away, right? So this is flexion, but abduction would be bringing it away. I know that's really confusing, but that's what it's doing, right? Flexion is thumbs up, abduct away from the palm. This muscle will also extend the thumb and then also abduct the wrist. So because it's crossing that wrist joint to get onto the joints of your thumb, if it's crossing a joint, it's probably going to have an action with that joint. So because it abducts the thumb, it's also going to abduct the wrist a little bit, okay? All right. It originates on that posterior surface of your radius and your ulna. So this is on both bones of your forearm. And remember that interosseous membrane that kind of joins the two bones together, that connective tissue? It's kind of hanging out attached to that as well. And then it runs down to your thumb joint and it attaches on that first metacarpal. And this picture actually has all of the extensors and this abductor. I'm going to zoom so you can kind of see. They're kind of all around in the same area. So if people are having thumb pain, not only are you going to just work the thumb because it feels good, you're going to work all of those forearm muscles. So wrist and hand issues a lot have to do with the forearms being tight. So I'm not going to go in great detail about all of their attachments because they're kind of all around the same area and do a lot of the same actions. So here's that extensor. Again, we're extending the thumb out. We're also extending the carpal, metacarpal joints in the phalanges, right? And then since it's on this side, it's also going to put your hands in anatomical position into abduction. Okay, so it's pulling that all that way. Boo! So here is the longest. See how that's in kind of lower central part of the forearm. This is a tiny little guy. This is probably what's inflamed on me, honestly. This is the extensor pollicis brevis. And then I'll kind of show you. This extends the thumb and all those little metacarpals. Or digits, I'm sorry. And also, since it's on that side of the hand, it's going to abduct that wrist out as well. But see how most of this muscle, the meat of it is in the forearm and the rest is just tendinous. So that is pretty normal for most of the muscles in the forearm that move your hands. So most of them are very tendinous. And you can see tendons all on the top of your hand. When you're moving it, you see it kind of wave. All right. Okay, here's the flexor. So those ones extend. Now we're looking on the palm side of the hand on the flexor side. And this flexor for your thumb, if it's on your thumb side, it's probably going to be closer to your thumb, if that makes sense. So this muscle will flex the thumb. And it'll also assist with flexion of the wrist because it's on the flexor side. So it can do one of these and it can do one of these. So if I'm doing this, that muscle is doing both of its actions. Boom, boom, like you're riding a bike. So, yes. All right, now we're talking about the tiny, short little muscles of the thumb. Notice two of these short muscles say brevis. Brevis means it is a short muscle. Longest means it's a long muscle. So here, I don't know why this is at this section. Let me see. Whatever. These are showing your joints of your hand. So the first picture, your carpo-metacarpal joint. Break it down. It's the joint where your metacarpals start and your carpals end. So that joint is telling you its name. The next one is metacarpal phalangeal. So that is where your metacarpal, your hand bones, meet your phalanges. So that's what we're talking about here. The other ones in between are your so in between phalangeal joints. So if you ever were to see this on a test, just stop, think about it, think about what they're saying, break down the words. Okay. Abductor pollicis brevis. So this is in the meaty part of your thumb. Now you have your thenar eminence, that big chunk, and your hypothenar. I think we're actually going over those. But this is the padding of your thumb. It feels really good to massage when people use their hands a lot, is to really get into that thenar eminence, this whole chunky pad.
So is the thenar eminence over the abductor pollicis brevis one?
Don't quote me. I'm not sure which one is the deeper layer, but I can look it up real quick. I would say the abductor is, but it's probably not.
I feel like I've become a very sick person because I just need a cadaver now. It's like I just want to like.
I'm going to pull it up on my phone. Let's pause this so we can see. Then we'll have the answer. All right, so we've concluded that this muscle here is the most superficial upon our findings. All right. So the adductor pollicis brevis adducts, also assists with opposition, right? Okay. Flexor pollicis brevis, tiny little flexor muscle in your thumb. It also helps with opposition. Moving on. I'll let you guys look at all your attachments. See how most of these are actually starting on a carpal bone? So, that's why when you're doing hands and working on someone who has hand issues and maybe carpal tunnel, you can do some extension work while you're working along here. You can even kind of do some gentle work on the carpals and see how my wrist is just moving. You're not going to push hard because it's bones, right? But just getting some blood flow to that area and some range of motion with the wrist might make it feel good, okay? So if you're having hand, thumb issues, work the forearms good, get into the wrists, and then you can work the hand by doing different stretches with it. So this is the opponent's pollicis. This is the main opposition muscle. All right. This chonk is the adductor. So this is going to bring your thumb back. And no, it's not back like this. It's going to bring, this is abducting. It's going to bring it back to center. So a real adduction, like if I were to hyper adduct, we'll call it, is going to be bending your thumb backwards like this. All right, so it's going from this position, bringing it back is what an adduct. We're adding it back to the hand, per se. Because a flexion, remember, actually, this is extension. A flexion is actually flexing it across into the hand. I know the thumb, I don't know who decided that these were the thumb actions, but they're rubbish. These are the lumbricals. These little guys hang out between all the carpal or the metacarpal bones. So all of your little finger or hand bones here, these are going to help you to extend. So when you're shocked, you are extending your fingers, and your lumbricals are kind of in gear here. It also can help flex digits 2 through 5, so it's not doing anything with the thumb. The word pollicis isn't in this word, so it's technically not doing, no, not technically. It for sure is not doing anything with your thumb. So the lumbricals are going to affect these other digits. Pretend you have no thumb. So they're going to kind of hang out on something called the flexor digitorum profundus tendons. So that is a muscle, the flexor digitorum, that flexes your digits. It's going to kind of start on those tendons as well. And then it runs down, connects on the phalanges, so therefore you can extend your hand and fingers. Extending. Palmar interossae. So an interossae is connective tissue. So kind of like the connective tissue that runs between your radius and ulna. So this is tiny little muscles in here, kind of in the same areas where your lumbricals are, and they will help to abduct. This one is also on the thumb. So it's all the palm side of your digits, including thumb. It'll help abduct them. It'll help flex the thumb a little bit and extend the thumb a little bit. So this palmar interossae is kind of doing all those things. All right, so I'll let you see. So here's the lumbricals, palmar interossae. And here's the dorsal side. So again, these are going to help. I'm going to go back. This one, adducts. These are going to abduct a little bit. Abduct and flex at the 2, 3, and 4th fingers at the metacarpophalangeal joints. And they'll also extend the fingers at the interphalangeal joints. So see how they're kind of doing a couple different things with your hand. Without all these tiny little muscles, we're not going to be able to do the abduction, adduction, flexion, extension with the hands out. So now let's talk about the muscles and part of the hypothenar region. So these are your abductor digiti minimi. If you see minimi, we're talking about the mini little baby finger, the pinky. So the minimi muscles, if you read this, just look, say flexor digiti minimi brevis. So we're going to take the last word. It's going to be small. It is pinky finger minimi. It's a digit, and it's flexing. So can you guess what it's doing? Flexing the baby. All right. That's the good thing. Yes, the hand and the forearm muscles are difficult, but they tell you most of the time what's happening, what the main function is. So the abductor digiti minimi is going to abduct your baby finger. It also kind of helps with opposition with the thumb. So not only are we abducting, we're also opposing. These start at the carpals. The pisiform, to be exact. So the pisiform, pinky, it's always on the pinky side, right? So that's going to be that carpal bone on the pinky side on the proximal part. All right, runs down, connects onto the phalange, and helps move things. All right, so we're going back here. Abductor digiti minimi, and then here's the flexor. See that they're kind of around the same area. All right, so it does flex. That's what the name says, and it also will do opposition. This one, so just under the pisiform is your hamate bone. So this connects onto that hook of the hamate. I'm going to zoom so you can kind of see. All right, so the hamate, there's a hook here, and that's where it's kind of starting. Here's a better picture here. See how there's some connective tissue turning into the muscle. So that's the flexor digiti minimi brevis, tiny. All right, this is your opposing muscle. So opposition, opponens digiti minimi. Say that 10 times. And this, again, is also going to start at that the hook of the hamate, run down, connect onto the metacarpal, and help with opposition. Woo! Be an artist. Fiber direction. So as you're learning, try to kind of learn where the muscles are located and which direction the fibers are going in. Most of them are going to be, towards the heart, up and down, but you're going to have some because of any rotations or supinate and pronate, whatever part of the body is it's going to be angled, kind of like your rhomboids. When we learn the back, we're going to learn the rhomboids are angled because that's the position that they're moving that scapula in. So as you're learning muscles, try to think as you're massaging them what muscles you might be addressing and what direction they might be going in. Look how far you've traveled. We traveled well. So this is just bonus here, the ligaments and other structures. You don't need to know all the ligaments and everything. Just know that they're there, okay? I don't know if there's any ligament questions on the MBLEX. If they are, it's something stupid like, I don't know, yeah, an attachment or the flexor retinaculum, which is here. There's might be some aponeuroses, but so this just we're going to go quick over this just so you know. I just want you guys to be aware that there's other ligaments inside your hand and wrist and forearm other than muscles. So the radial ulnar joint and the humeral ulnar joint, that is where your radius and your ulna meet, and then your ulna and your humerus meet. So the name tells you what it does or where it articulates. So there's all kinds of cool ligaments in here that you can tear and you can injure. So a strain is a muscle and a sprain is a ligament. So you can sprain any of these ligaments in here. So here's your humerus, ulna, radius. I actually have it kind of highlighted so you can see what's going on here. So deep in here is your lateral epicondyle, right? Behind this ligament. And then this is the opposite side, olecranon process. But just see, our bones aren't just hanging out. They're all connected so that, things function correctly. So we'll think of this as your body's brace. Your ligaments are your bone braces. Okie dokie. This is fun. So this is teaching you to palpate the flexor retinaculum, which I feel like it's a given here. Here's your extensors. All right. So this main flexor retinaculum, when this gets inflamed, it can also affect your carpal tunnel issues. But you'll kind of see how all those flexors run under it, and this keeps it bound like a cord. Here's your extensors. All right, and you can't just feel it. It's so thin. You're not going to just feel it and be like, oh, that's the retinaculum, but know that it's there, all right? And some diseases and stuff might have thickening of connective tissue. So the thickening might cause pain because it's pinching nerves, might cause range of motion issues, swelling, all that fun jazz. In your arteries, so if you're working on somebody and you feel a pulse, don't continue working on that area, all right? Or lighten up, okay? In this case, if you're trying to see if somebody's alive, typically you go for the inner wrist, right? What they're doing is trying to find your arteries in your wrist, all right? So veins and arteries will run all through there and kind of be bound up by that retinaculum. So obviously the ulnar side will be towards your ulna. The radial side will be towards your radius. So I don't know. Try to see if you're alive. So that's what you'll typically do. I'm alive. All right. Ligaments of the hands and wrists. So these are ligaments in between the radiocarpal joints, intercarpal joints, metacarpal joints, so on, so on, so on. So that is all the ligaments that go all through here that connects your joints of your hand and wrist. That you can also sprain. Please don't sprain your ligaments. So you'll see that your carpals and everything have ligaments all around them. Because also, again, we don't just have bones hanging out in your wrist. They are there, they are structured, and there is a reason. See this P here? It looks like a P. This is your pisiform. So if you're looking at a bone, and here's your hamate, and see the hook right here? If you're looking at the bony structure of a wrist and you look for those landmarks, you'll automatically know that that is this side, the palmar side of the hand. And then here is your dorsal side again. So some ligaments in the wrist. Here's teeny tiny little guys. So you can tear all kinds of fun tiny little things that will take a while to heal. Typically, ligaments, they can take weeks to heal. Once in a while, months. Typically, it's weeks. So my rule of thumb is if something hurts more than like a month and it's not severe, I can probably wait it out. But probably bad advice to give. So more metacarpal and metacarpal joints. So see how we're just getting tinier and tinier and working our way down to the phalanges almost. So again, these are your dorsal, side of your carpometacarpal ligaments. Did I make you guys right anyhow? So here's your joint capsules. Nobody has this, right? Okay, so trigger finger. Remember the trigger finger we kind of discussed, was it the last week? So what's happening is these tendons are going through these joint capsules here, and the tendon will become inflamed and not be able to slide through that correctly, and then there needs to be some surgery to clip the connective tissue to make room for that tendon to freely move through that capsule or ligament. Here's a cool picture. So here is your hand if I were to cut it and look at it from this direction. So it says in this yellow box, when someone's experiencing carpal tunnel, that median nerve, you need to know that it's the median nerve. I have so many quizzes where it's asking that. It's probably going to be on the MBLEX. It's a good possibility. So the median nerve is being compressed by the flexor retinaculum or structures around it. They also call if you see flexor retinaculum labeled as the transverse carpal ligament, it's the same thing. So transverse goes across, carpal, it's at your carpals, it's a ligament. So here's some of your carpal bones we're looking at here. This would be your hamate, and then you're going backwards. She likes to try to catch her hamate, capitate, trapezoid, trapezium, right? So if I were to zoom here, these are all the tiny little tendons coming from your flexors, right? And this buddy right here is your median nerve. So see how if any of this stuff is inflamed or even the muscles around it into the hand, it could kind of pinch that nerve. So it's very easy nerve to damage. We are fully at the end. Thank you.